Functional and integrated psychology theory. Welcome to the today's sessions where we will talk about the growth, development, and eventual establishment of the psychological theories, both in terms of its early years to the present state of affairs, as in function and integration is required. So, what exactly is psychology? The term psychology comes from the Greek roots altogether. It tells the word called psyche, meaning your soul, your mind, and logos, meaning the study of it. So, basically, the study of your soul, the study of your mind is what psychology is all about. It psyche and logos. Remember, when these two were merged, psych logos became psychology shortly and slowly but definitively. So, what is psychology? Psychology is the science of human behavior and mental processes. Behavior, remember, is anything we do. Overt actions and reaction is all about psychology. Mental processes are our internal experiences, thought, feelings, and memories. This is what we aspire to go across with it. In terms of psychology, is the science of human behavior, mental processes. Behavior, remembers, are exhibitions of your thought process, basically the actions or the reaction that you manifest in your real life. Mental processes are the internalizations of your behaviors and experiences. These can be termed as your thought, feelings, and memories thereby. So scientific psychologies have four basic goals. One, two, three, four. One being to describe, two being to explain, three being to predict, and the last will to change the behavior or the mental processes. So basic scientific psychology is to describe, is to explain, and probably predict and manipulate the behaviors or the mental processes. That is what functional and integrated psychology is all about. It has to have these four goals around. So psychological information is based on an empirical evidence. This information is directly based on the observation and the measurement with scientific methods. Thereby we need to understand these scientific methods thereby every now and then. Please do remember what we are trying to impress upon you. So, where did psychology come from? First and foremost, this was done by Wilhelm Wundt. The first lab was created way back a couple, few centuries back, more than a century back, in 1879, approximately 1.5 centuries from today. As of today, you will talk about William Wundt, who actually prepared the first psychological laboratory. Wood was responsible for the first school of psychology called structuralism. Remember, being functional and integrated psychology, this was the first step of structuralism as in functional psychology was concerned. This school focused on immediate emotions and thought processes. Thereby is all about structuralism. But is structuralism prudent enough? Come, let us explore. There are problems with structuralism. This group of psychologists use a technique called introspection, which was described self-examination, where the person is describe and analyze thought as they occur. Now, this is very important, of prime importance to all of us. This group of psychologies are calling this as an introspection. Introspection are very subjective in nature. When we talk about the self-examination of the person describe or analyze, let us understand the steps out there. The first step was to too narrow. Absolutely. How can you talk about a person's mindset? Let us, this is not even a collective conscious, and so it cannot be very much validated. Being it was a too narrow. They studied people only like themselves, very wealthy, very white males. What about the rest? kind of people to the rest cross section of the society. I'm talking about from different background, from different color of the skin, from different sect, from different region. How do you go around with structuralism? Not a valid research was produced. Nevertheless, this school of thought was a great start as it laid the foundation stone for this brief of study on psychology. But believe me or not, structuralism as of today does not exist at all. This is what is very surprising because of the fact that I've already told you it was too contextualized and too narrowly focused on individual, probably which cannot be validated over a period of time. So what happens? What happens to the next evolution? Here comes the functional psychology, and probably then we'll integrate it in our day-to-day work atmosphere. Functionalism is the second perspective to be emerged. Now, this was propounded by William James. Now, what do they study? They study the reasons and the process, how and why the mind functions, why the mind functions in a particular fashion, and how does it come to arrive to a decisions to function in a particular fashion in the first place. This perspective broadened the scope of psychology and applied psychology to the practical settings all by themselves. This perspective still focused on the consciousness but begins to examine overt behaviors, not just the mental process. Absolutely behaviors that have been displayed. Now the thought process have taken a backseat, but essentially psychology would be a combination of your internalization and the display on the external fashion as the case might be. Psychology continues to expand based on the early work of the three perspective. Now we'll continue to the perspective that comes around it. This perspective that the psychologists have different ways of looking at behavior to understand what we are looking in the first place. This is what we tell about here. What are the different perspective, the integrated perspective? We need to integrate all these things: the psychoanalytic perspective, the behavioristic perspective, the humanistic perspective, the cognitive perspective, the biopsychology perspective, the social psychology perspective, and the evolutionary perspective. Briefly, I'll give you a glimpse to every one of them right now out here. Psychoanalytic perspective will tell the mindset of the people as to what kind of upbringing led to a certain particular thought process. Behavioral perspective is what a person, what a group of fellow has been subjected to, what kind of behaviors. If he or she has been recipient of decent behavior, the society been treated them well, they will come out to be a gentle person. But if it is not the case, they also become ruffians in the society. So it's the behavioral perspectives to which a person has been exposed to. The humanistic perspective is where we have the feeling of compassion. This is when you have certain personal emotion entrenched into the deeper conscious of a person, which might get stimulated from time and again. It remains mostly under a subconscious level. Cognitive perspective is where people do manage not the emotions to a larger extent but think rationally as such. Then comes the biopsychological perspective, as in certain people are endowed with certain virtues as far as physicalities are concerned. People are tall, short, physically challenged, and so on and so forth. And accordingly, believe me or not, their perspective or thought process also change. So people from a different colored background will have a different thought process altogether. Social psychological perspective is what the society entrenches upon it, what the society expects you to do, follow the rules, and so on and so forth. So you have the luxury to follow, to fall in the trap of the society wanting you to fall to it, or be a rebel around it. And that is what is social psychological perspective is all about it. Evolutionary perspective is the way we grow. It's a chronological perspective where we grow as a person or a deteriorate a person incrementally but duly on a regular fashion. And that is what the evolutionary perspective would all be going around it. Let us understand, who hasn't heard of Edmund Freud? Now, this is the most most significant psychological perspective developed by Sigmund Freud that we talk around it. Freud is believed that the emotional problems are due to anxiety from unresolved conflict that resides in the consciousness or the subconsciousness level, or does reside at an unconsciousness. You are not at all aware of it, but that trauma, that feeling is always within you. And this is what Sigmund Freud told, tells, and displayed and demonstrated time and again. The psychoanalytic theories of Freud as an early pioneer in treating emotional disorders was to first find counseling and therapy to patients. This is what we talk about, the dream interpretation or free association of the person developed to explore the unconscious process altogether. Uh, Therein we come forward to what might be lying beneath the conscious level. Psychoanalytical theories was one of the first steps that Sigmund Freud took for emotional disorders, and we have complete theories around it. Freud theories were the first to suggest that our childhood experiences impacts profoundly on our adult behavior. The first to provide therapy for patients. Develop dream interpretations and free associations is what we are looking at it. This is what we are telling time and again. Behavioralism is the opposite of psychoanalysis. Behaviorism was founded by John Watson in the direct opposition of psychoanalytical theories. Behaviorism focuses on behavior that can be measured, that can be observed, that there is a return to the scientific approach to the psychology. We can describe, protect, and control those behaviors time and again. Behaviorism is the opposite, absolute opposite of psychoanalysis. Now, psychoanalysis is what people believe are being controlled by the environment. This is what behaviorism also focuses on. Of behaviorism is all about the explicit behavior that a person displays. The psychoanalysis will always be the reason behind those behaviorism altogether. We are the result of what we have learned from the environment time and again. Cognitive psychology believes that behaviors are formed because of the ideas, because of the thought, because of the germination of feelings inside the person. The cognitive perspective focuses on such process such as perception, memory, and thinking. That's what the area of psychology believes to be. Cognitive psychology currently exerts a very strong influences on psychology, absolutely on the thought process that we are hampering around it. It is the mental aptitude, the cognitive ability, which plays the pivotal role in our display of our behavior, our exuberance, or the reticent nature of a person. That is all about cognitive psychology. Remember, cognitive perspective focuses on perception, on memories, on your thoughts. Let us understand biopsychological perspective, the how the biological factors affect the mental process and how the brain affect behavior. Behavior and biology interact in much important ways. We'll discuss those impact in this field of examining psychopharmacology, development, and genetics. As in biopsychology is concerned, depend. And now we are talking about biotechnology, where when the chips will be installed to aid to your vision, to aid to your beating of your heart, to aid to the functioning of the brain in the right fashion. We are looking at so many possibilities that might actually help us in the long run. So these are the some of the areas of psychologies that are being currently studied. The integrated psychologies which we want to go around it. You remember, from structuralism to functionalism, from functionalism to the so many number of branches that we have come around it, and the integrated psychology is what we are looking at it. Remember, this is how we function, this is how we excel, and this is how we probably manipulate the behaviors of a group of person of your behaviors and try to come up with solution which is win-win in all for everyone. So research and professional areas of psychologies would be development psychologies, the integrated psychology that are talking about it, the social psychology, the experimental psychology, the physiological psychology, and the cognitive psychology. Now what are we talking around? Now, this is a psychology where we can actually manipulate the behaviors of crowds, controlling the crowd, how people will be working or behaving in certain undefined situation, even if we can predict those situations beforehand and probably going around. Let's say in a very tough football match stadium where there is a crowd which is into hundreds of thousands of people and with very a limited way of exiting or entering procedures, and if there are any mishaps, how will the crowd react? What is going to happen? Will there will be more fatalities or calamities because of the crowd behavior or because of the mishap? If we can go around it, this is all about being social psychology or experimental psychology that comes around it. The the crowd conscious that comes around as far as the cognitive psychology is all about it. So we talk about personalities, we talk about the clinical psychology, the counseling psychology that comes around it. Remember, personality, clinical psychology, counseling psychology, education and school psychology, industrial and organizational psychology, which comes around it. Definitely, yes, we are more interested in industrial and organizational psychology. And that is what the integrated psychology is all about it. Remember, this particular presentation we built in from structuralism to functional to so many of psychology that comes around it, be it biosocial, psychological, social psychological, and so on and so forth. And the application areas has been displayed on this particular slide for your convenience and understanding. Yes, it is true. Psychological studies can impact and influence every sectors and every spheres of the life of a person. So let us talk about the development psychology looks at a human development across the lifespan. Development psychology once focuses on primary on child development, but today devotes a great deal of research at adolescence, adulthood, and old age. Yes, very true. In terms of social psychology, it focuses on interpersonal behaviors, the way we portray our own role in the society, which is governed by the rules and regulations of the society. Typical topics include the attitude change, prejudices, conformity, attraction, aggression, intimate relations, and behaviors in group. How do we go ahead with it? Experimental is encompassing the traditional core of topics such as sensation, perception, learning condition, motivation, and emotion that goes around it. We come to the physiological psychology. Now, this is where the genetic factors plays primarily a major role in forming our behaviors, the role of our brain, the nervous system, the endocrine system, the bodily chemicals in the regulations of the behaviors around it. Cognitive is focusing on the higher mental process such as memory, reasoning, information processing, language, problem solving, decision making, and creativity. Personality is all about being interested in describing and understanding individual consistency, individual behaviors that represent a person. These are the areas of interest that shape the character, the personality, and probably the way to figure out how to handle such person. We the last slide for the day is all about being clinical. Clinical psychology concerns with evaluation, diagnosis, treatment of an individual with psychological disorders. Some of us might be suffering from OCD, as in obsessive compulsive disorder, as in doing a thing again and again, or be not sure of have done doing their things. Probably someone might lock their office or lock their room, and after a few moments would come back to check whether they've actually locked it or not. This doubt that is there in their mind is OCD. Somebody might be obsessed with cleaning things, somebody might be obsessed with making things and a spick and span. The way you want to go around it, there are people who are bit like to keep themselves neat and tidy, take regular baths, clean themselves, take good care of their health. This is what can be known as obsessive compulsive disorders. These are basically psychological disorder which can be treated of less severe behaviors and emotional problems. Principal activities include interviewing clients, psychological testing, and providing group with individual psychotherapy. Counseling overlaps with this clinical psychology in that specialist in both areas. Engage in similar activities, interviewing, testing, providing therapies. Counseling psychologists usually work with somewhat different clients, providing assistance to people struggling with everyday problems of moderate, severe, whatever you call it. They specialize in family material, or should I say, marital or career counseling. We come to the educational ways. Now things have changed on an educational platform altogether. Look how you people are gaining education with the help of watching a video. Probably are unheard of by your parents, and they might not have done this thing prior to that generation. It was the imparting of education with the chalk and talk methodology. It was the efficacy of the teacher which will determine the quality of education out there. But right now, everything is at your fingertips. It is up to you to observe and assimilate the knowledge from every year. So educational psychologists have changed. Basically, they earlier used to work in elementary and secondary school where they test counsel children having difficulties in schools. Then the IO problems, or the input and output problems, perform a variety of tasks in the world of business, the industrial business, the organizational business that we talk about, of running the employees, the human resources, working to improve staff morale, attitude, striving to increase the job satisfaction and productivity, examining the organizational structures, procedures, and making recommendation for improvement. This is what I say is the utilizations of functional and integrated psychology. I'm sure almost all of you should have been illuminated by watching this video. Thank you for your patience.